United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Welcome, everybody. Has anybody had a chance to review the minutes? And I had a chance to review them. I don't have any changes. Anybody have changes they would like to recommend to the minutes? Then may I have a motion to approve?
Motion to approve?
Any objections? Hearing none, minutes are approved. With that, I'd like to get to one of the fun parts of the meeting, and that is our organizational issues. And today we have two new members, which I think is record time for quickly filling spots. And I think with two new members, the best thing to do, the thing I'd like to best do, is to ask them to spend a minute and tell us who they are and why they're here, and then ask the other members of the board and attendees at the meeting to give a 25-word or less summary of who they are. So let's start with Lisa. And you have, yes, you hit the...
It's very official. Hi, I'm Lisa Bannister. It's great to be here and to meet all of you. I'm a clinical psychologist in the area, and I've been in private practice in Wayne for about, I think it'll be 16 years this year. I'm also a mom to two 11-year-olds who are in the Radnor School District. So I'm just really excited to learn about some of the health initiatives of our community and to be able to have a voice to, positively influence, our community and our kids and what goes on around here.
Thank you.
Yep.
And Andrew Baronato?
Hi, everyone. Andrew Baronato. I work at Independence Blue Cross in government affairs. I have about 20 years of healthcare experience, and I'm happy to be here, meeting my new neighbors, and hope to do good work here. So, thank you.
Welcome to both of you. Thanks. So let's start down at Seth's end and go around and introduce ourselves.
Hi, I'm Seth Rubin. I'm a family medicine doc. I work for Mainline Healthcare.
I'm Alex Yiannopoulos. I contract with Mainline Health through Aramark. I previously was patient services manager at Paoli Hospital, now working in talent acquisition.
Hi, I'm Angelica Carianis. I am one of the Radnor School nurses. I'm a nurse and have had 4 of my kids all go through Radnor schools. They're all Radnor alumni, so I'm happy to be here. Doing well.
There are 3 folks who aren't with us this evening. One is Lisa Duman, who's an endocrinologist in the region. Julie Kohler, who you know, who's also a psychologist in the region, and Bob Desidue, who's on the staff of the oral maxillofacial surgery department at Jefferson, and they each had professional issues that kept them from joining us tonight. Maggie and Jenny, would you introduce yourselves as well, please?
Sure. I'm Maggie Myers. I'm the Ward 2 Commissioner for Radnor Township, as well as now the Vice President of the Board of Commissioners of Radnor Township. And my other hat is I'm a retired neonatologist, worked for years as the Associate Director of Neonatology at Children's Hospital of Philadelphia.
Hi, I'm Jenny Lesage. I'm the Director of Student Services and Special Education at Radnor Township School District. I've been there in some capacity. I started as the Assistant Director in 2014 and became the Director in 2018. Welcome.
Thanks. And I'm David Simmons. I am a retired old codger who used to be a diabetologist for many years. Half of my career spent in academia and half spent in industry. I've been on the board 6 or 7 years now, and I've been the chairman. I think this is my third year. And a couple of comments about the board. The board is a volunteer organization, and it is not a budgeted organization. As a consequence, any impact we have comes from the work that we do, and the work that we do comes at us from a number of sources. One is the board. When the board has issues that requires health insights, they have come to us on issues like the mold mitigation issue at Villanova, or what to do with the aggressive marketing practices of the Delta 8 Kratom store on Lancaster Avenue, and other issues, or issues that we raise ourselves. So we're in the process of totally revamping the animal ordinances that came out of our own imagination. And we also have a student intern program. Our interns are unable to make it tonight, but that's been one of the things that has been ongoing annual fun and rewarding, and keeps us tied in. So with that, I welcome everybody. Any comments, questions, concerns, issues before I move on? All righty. So the next agenda item is something that I changed up for the last 3 years or so. It has been, first it was a COVID follow-up, and subsequently a respiratory illnesses follow-up in this season when we had RSV and flu to contend with in the fall. And now I've changed it to community infectious diseases follow-up. And generally what I do is I review CDC website, MMWR, State Department of Health website, and the literature that I follow, and try and bring up topics that I think are relevant to the citizenry of the township, and to which we should keep our ears perked and our eyes open. As of right now, there's really nothing much to say about COVID. The data are poor. It appears to be endemicizing. The numbers are going down. The severity of disease in the post-Omicron phase does appear to be reduced, as does the probability of developing long COVID. But I think we still have a long haul in an epidemic where 1.25 million people died, predominantly over 65, but that meant people lost parents and grandparents. And I think that we must not forget that there are long-term issues that will need to be addressed, and keep our eyes open for that. RSV seems to have come and gone. Norovirus is out there, but does not appear to be epidemic. It was raging a little bit in February and beginning of March, but seems to have calmed down. With regard to influenza, the significant early peak that we had resolved the way most flu peaks resolve. I would remind people that it is completely normal to have a second peak. Doesn't happen every year, happens a lot of years, and the second peak usually starts right around now and can happen anywhere through the kind of the Mother's Day time frame. So keep your eyes out. Hand washing and mitigation in the presence of flu is always remains a good practice. The last thing on the communicable diseases that I would bring up, you may have heard, if you follow any form of news feed, that the CDC had issued a warning about babesiosis. I think that it was a little bit overplayed in the lay press, in that the CDC published a completed study of babesiosis from 2011 to 2019, and as a consequence, that report was issued as a warning. Babesiosis is a tick-borne illness not dissimilar to Lyme, although I guess the bacteriologist would have my head on a platter for saying that, but not dissimilar to Lyme. Its mode of transmission is very similar to Lyme. It comes from mountain tick bites. The mountain tick is resident in deer, although people do not tend to get the ticks directly from deer, but they get the ticks from the white-footed mouse, which is as common as can be out there. And this time of year, when people get back out into their gardens and the mammals come out of their nests, the probability of tick bites does increase. Pennsylvania was borderline with the increase of babesiosis, whereas New York, New Jersey, Connecticut, they were all flashing bright. But it should be kept in mind when people have presentations not dissimilar to Lyme, rash, unexplained fevers, unexplained illness, and especially if you come up in a circumstance where you think you ought to have Lyme and your Lyme test is negative, your doctor should be testing you for babesiosis. So I think that is an awareness issue for the community, and definitely for the healthcare providers in the community. Not my job to educate the healthcare providers, but if you have a suspicion of a tick-borne illness and you have had a Lyme test but it comes back negative, you should definitely ask for a babesiosis test. And the testing is good and similar to the Lyme testing. And that's my communicable diseases update. Any questions, concerns, or comments?
Just one real quick comment, which is that I had been at one point tasked with providing updates on the county health inspections, and did just want to update it. It's not that I haven't been doing that. The county is doing them in phases, so they kind of hit Radnor all at once, and we just haven't had any really since kind of the last round over the summer. But we'll resume that when I keep checking every month to see when they restart.
So to summarize, you're doing the scan in the background. Excellent. Thank you. Thank you for that, Alex. And actually, that raises something that I didn't discuss when we talked about organizational issues. And for our new members, one of the reasons that the Board of Health in Radnor Township exists was that up until a year and a half ago, I guess it is, there was no county Board of Health in Delaware County, which when the pandemic hit, that was not a good place to be. And we borrowed services from Chester County for the first year and a half, but in the subsequent times, there has now been a Department of Health established in Delaware County, which is critically important because healthcare, governmental support of healthcare comes from federal through state through the counties. And in the absence of a county Department of Health, it was very difficult to deal with all the governmental support and concerns during pandemic. But it also meant that the raison d'etre for Radnor Township having a Board of Health was actually called into question. And we did a couple of things that have now been taken over by the county. That includes inspections of food services and swimming pools and health inspections. Interestingly, the officer who is in charge of the county department used to do those inspections for the township, so we have a strong connection there. Things like programs for the elderly in the severe heat and in the severe cold are now handled at the county level, and the county is responsible for insect spraying, which was another issue that we had questioned from the Board of Commissioners about a couple of years ago, another service. So we exist to serve and support the citizens and the Board of Commissioners of the township in a different role now. And one of the things I thought was important, we asked the school district, and as a consequence, Jenny now joins us because I can't think of any one single site in the township that's probably a greater site of Board of Health related issues than the school district. And I've tried to, and Maggie has been a great support in tethering us to the Board of Commissioners. Questions, comments, concerns? All righty. So the next agenda item, our old business items, I'll move B to A, and Bob Desidue is unable to attend tonight, and he is struggling a little bit with a project that he initiated at the end of last year, and that is to get the oral health care van that Crest Toothpaste has operating and sends out to do programs, mostly at schools. And there is, I don't have enough direct information, but there is a negotiation going on with the school district and the principals of 3 of the elementary schools, and I'm not sure how that's going to play out. So I'm going to leave that to Bob to update us, but we're kind of stuck there. And that will be another old business item for next month's meeting. The first item, I'm going to turn over to Maggie to give us an update on the animal health ordinances, which for our new members, this was a project that one of the people who rotated off of the board, Joan, is a veterinarian in the region, very, very interested in animal health in the region, and took on by herself a pretty monumental task to rewrite township ordinances that go back to the mid-'60s and bring them up to date with standard practices and the state of the art. And Maggie was kind enough to take that over from Joan when Joan left. So Maggie, to you.
Yeah, so we're still busy working on it. It's getting close to being ready to hit the lawyers for some additional legalese. But I did meet with Bill Gallagher, our animal control man, and for the township, and Tammy Cohen, who is Parks and Recreation Director, about the sort of overlap in the animal issues and some inconsistencies that are a little bit of a catching point right now. So the animal ordinance states that dogs at large should be on a leash if they're not on their own land, essentially. So if you're walking down the street, wherever, you're not on your own property, dogs should be leashed. The Parks and Recreation Department instead says that dogs should be within sight of their owner, I believe, or maybe with their owner, I can't remember how that's phrased, but under control. So herein we have a little inconsistency in the two, and in trying to make them mesh, it becomes a very emotional issue for a lot of people. You know, dog owners don't want to keep their dogs on a leash if they're back on the Skunk Hollow Trail. At the other hand, we have talked briefly about the Willows Park Preserve, who is now doing catered events and weddings and the like. Dogs are not allowed in the Willows Park Preserve. However, to get to the Skunk Hollow Trail, most people park in the Willows parking lot, and the dog should be leashed until you get on the trail, and then it just has to be under control. But a dog gets out of the car, smells that good food at the lovely wedding or bar mitzvah or whatever, and goes running over and leaping on people. There was some concern also that people are not using the trails because they're afraid of dogs, and that's an infringement really on some township people's rights, if you will. So I started digging into this a little bit. Lower Merion, interestingly, has several dog parks, and one of them so they have an ordinance that also says dogs should be on a leash. But their parks area has a unleashed trail system near one of I think it's Rolling Hill Park in Lower Merion. And there you're allowed to have your dog off leash. Here at Harford Park, we're allowed to have our dogs off leash running around. There, however, what they have done, and I think it's something we should think about, is they require a permit for the dog, which in applying for and paying for on an annual basis, you have to show that the dog has been adequately vaccinated against rabies, and that you are a resident, some things like that. And then the person gets a little pass that they can have their dog in the dog parks, I think in any of the parks, actually. And that's a little, I forgot to ask that question, and it's a little written a little bit difficult to understand. And the dog gets a tag that shows that they're a legal user of the park, if you will. And it's just sort of an interesting idea. Otherwise, for vaccination purposes, it is a county issue, not a township issue. And a lot of people are actually not getting their dogs vaccinated against rabies. We had a case of rabies a month ago at the Willows Park Preserve with a rabid fox, documented, that a dog off-leash went after. And we haven't had any since, so that's good. But all of these things are concerned, and they're a little bit of sticking points in pushing things through. The question of enforcement of some of these issues has come up, in that we're not a national park with park rangers, that kind of thing. Police can't patrol the parks all the time. But anyway, I'm trying to work through those things. I think that's about where I am, so.
So Maggie, I think we need to be, I think the Board of Commissioners really needs to take a stand here. A leashed dog is not a problem to anybody else. It's a problem to the owner who doesn't want their dog on a leash. My father was a veterinarian, my grandfather was a veterinarian, my great-grandfather was a Prussian horseman. I'm an animal lover. But I also think we're no longer a rural community. We're not even an ex-urban community. We're a dense suburban community, and the attention that we pay to the comfort and rights of our neighbors has to be taken into account. This is not a Radnor only thing, however. It's been in the news for a couple of months now. An FBI agent shot another dog that attacked her dog on the streets of I don't even remember what city. It might have been Philadelphia. Yeah. So if people were perfect and they were considerate of other people and they kept control of their dogs without leashes, this wouldn't be an issue. But I don't think it's a Board of Health issue to decide which side to fall on. We could let chickens and pigs and goats into the township, and we could go completely wide open in that regard, or we can have rules and regulations, and regardless of the enforcement, the presence of a rule or regulation will have an impact if there is a disagreement between the human owner of a pet and a human who believes that they have been in some way, shape, or form abused by the pet of that human owner. So I really think the township needs to weigh in on that dispute, or it will end up with an off-duty person shooting a dog, or a person getting bit by an uncontrolled dog, or an animal being shot because of fear of rabies, and so on and so on. So I think it's important.
I do too. That's why I'm sort of been really trying to dig into it a little bit, because people have just been riding with this blaring inconsistency in the two different department, the real ordinance, animal ordinance, township animal ordinance versus the Parks and Rec rules and regulations. So
Every day, the online community fora, Nextdoor, or whatever, every day there's something happened on this trail or that trail. Somebody wasn't taking care of it. It's definitely out there. And with the weather warming up, I would expect an exponential increase in those kind of interactions. So
I think that's right, and I think that people really are afraid of big dogs who are boisterous and friendly and still jump on you and knock over somebody and they break their hip. There are all kinds of issues that. On the other hand, it will be a vicious Board of Commissioners meeting if we decide to vote on this.
Yeah, definitely emotions will ride high. And listen, I love the notion that we have the space to allow our pets romping space and so on, but we also have to have accountability, right? So if there's anything the Board of Health can do to help you with that, please get back to me.
Well, I think it's less health-related than we just have to make, as you say, just have to make a decision about this. So, and I think that's it. Oh, the other thing I was going to say about babesiosis, back to babesiosis.
I had another question about the dog. So can I just ask, in terms of the vaccination issue with deferring to the county, is it that we have to follow the county's rule no matter what it is, or is it a situation where if we wanted, we could set a higher standard, we just can't go lower than their standard?
I think their standard is that dogs should be vaccinated. It's just not enforced. So I don't know how we could really go higher than that other than documentation, a bright pink tag or something that's, when I grew up, the dog had a tag that said, you were vaccinated for rabies and distemper. We could go that route. It would be potentially a little bit of a moneymaker for the township in the registration of the dogs, but it would be a lot of work too for whoever had to deal with it. So,
Yeah, most people alive today haven't seen a world where there is no polio vaccine, there is no rabies vaccine, pets get rabies and bite people, and so on down the line. So we've kind of forgotten what life was like before before sewer plumbing and typhoid was common. The infectious diseases used to be what killed most people. Happened again for a couple of years here. So, yeah, I'm more than happy to help with the support of the board. By the way, go ahead. I'm sorry.
I'm very sympathetic to the plight of our dog lovers. I'm a dog lover myself, and I don't have a dog, so that's probably important for me to say. But I do appreciate dogs and what they bring. I think it is a public health issue, though, for everyone to be safe. And I think that when whether we talk about a leash or we talk about an animal being under control, I think when you're talking about a dog in a public place, that would be on a leash to assure everyone's safety in the areas that were being discussed specifically. I also think the same thing is true for vaccination. So I would recommend that the township take a strong stance on vaccination and leashing in public, so that everybody remains safe. And actually, I think it's safer for the dog to be on a leash. I know I have personal stories of that I could tell about dogs that have been injured because they have not been on a leash and were not appropriately restrained in a public place. So I really think it's a matter of public safety for everyone, including the dog, to be vaccinated and to be leashed in a public place.
I think the last thing you said is it needs to be emphasized. It's also a dog health issue, and you think your dog's fine, but then the alpha predator comes along, and your dog isn't fine anymore. So yeah, I completely support what Seth just said.
yeah, we see, I don't know how much time you spend at Harford Park if you don't have a dog, but there are fights all the time. I mean, and that is our one big dog park, and the dogs are running. They're actually talking about doing a fenced area for smaller dogs now, because it's often, the smaller dogs that are kind of getting eaten by the bigger dogs, but not always. Some of those little dogs can be pretty feisty too. So, and of course, being on a leash is no guarantee that a dog isn't going to nip somebody that's walking by, or, still be able to jump on somebody, but sure is a big help, I think. So we're working on it.
Thanks.
Back to my one little thing I wanted to say is that dogs do get babesiosis. So and they do get a clinical illness with it. So that's interesting. And the other thing would be that it's treatable. So it's not just a silly test you're sending off to intellectually know if you have babesiosis, or even if your dog does. It's easily treatable. So.
Thanks for bringing that. Yes, and caught early and treated early, you can avoid secondary and tertiary diseases, which are a lot less. They're treatable, but a lot less readily treatable, and a lot less grief ensues if you knock it out early without allowing it to take hold in your lymphatic system. So, okay. With that, let's move on to the student intern program follow-up. Alex will take that on with Lisa and the students absent, and give us updates both on the current program and the reorganization.
Sure. So our two student interns this year who are not here tonight, it's Ray Luan and Khadijah Teray. The project that they're working on is related to driving safety, specifically in the context of students and young people and people in general being tired in the morning, and the attentiveness issues and safety issues that may cause. I believe that since the last meeting there has been some trouble with Lisa and the student interns in getting in touch, but she has said that every time they have turned things in, they're right on track with where they need to be. So unfortunately, that's about as much of an update as I can give on the current round of student interns. But the other thing that we have also been working on is kind of standardizing some things with the process of how we select interns, what we're asking them to turn in, how we're choosing them, all of that, because we've kind of been doing things ad hoc, but then suddenly over the past few years, we've been getting many more applications. We went from, barely being able to fill the 2 slots, not that long ago, to then last year, I think we had 6 applicants, and then this year we had 10 for 2 slots. So, and we're sort of anticipating that trend was going to continue, may still continue, somewhat depending on the parameters that we put on applications. So we had come up with a list of some different things that we wanted to kind of decide on in terms of how we move forward with this. So the number one thing was who was eligible. In the past, we've opened to seniors, juniors, and sophomores. I believe that this year we did not actually advertise to sophomores. So Seth, myself, and Lisa had discussed some of these things online. Broadly speaking, we had agreement on a range of issues, and I think there were sort of 3 things where there was maybe a little bit of disagreement. So in terms of who is eligible, our feeling is actually that we should take a look at moving away from having seniors participate in the program. And there's a couple reasons for that, which is they have a lot going on in terms of, if there's any final things on applications that need to be wrapped up. There are some timing issues in terms of the fact that they finish earlier than the rest of the students and then go to senior week. So very often that, week or 2 less that they have of school means that we have them for an entire less meeting, which means on our end we're really missing them for an entire month. And also just the opportunity for possibly some of the younger students, like in the sophomore age range, that there's ability to provide a little more guidance and nurturing versus seniors who, their path, at least in terms of where they're going to school, and what they're going to be doing in school many times is already somewhat more set by the time they get to us in September of their senior year. We were pretty much all in agreement that we would like to open it back up to sophomores, and I believe juniors as well. I think, Lisa expressed a little bit of concern even on the junior end in terms of that's really their heavy-duty year in terms of applications, SATs, retaking SATs. For many, that's going to be a big year for AP. So that's the other thing with seniors is also the AP classes all kind of finish earlier because the exams happen before the end of the school year. But many juniors, especially, the more competitive ones, are also going to be in those AP classes. But I think if we just restrict it to sophomores right off the bat, we're maybe going too far in the other direction and risking not getting enough students again. So I think basically we were all on the same page of, juniors and sophomores is really who we should be advertising the program to. Now, the catch with that is that in prior years, because we were open to seniors, we actually weighted in favor of seniors because of the logic that they would not have the opportunity to apply again in subsequent years because they're going to be graduating and leaving us. My suggestion for that is that for the next year, in addition to opening it to juniors and sophomores, we also open it to seniors who already applied as juniors, because I just think it's unfair to the current juniors, rising seniors who already applied. If, for the in 2 cases they've applied twice, and then we have 3 others who also applied last year as juniors. I just think it's unfair to say, they were told in the past that we were waiting in favor of seniors a little bit, and then now in their senior year, they wouldn't even be considered. I think that would really not be fair, especially since all 5 of the juniors who applied this year took us up on the opportunity to get feedback on their applications and how they could improve going into next year. So I think, Lisa, Seth, and I all kind of agree on that as sort of a midpoint of phasing out seniors, is to, for 1 year, open it up to seniors if they already applied previously as a junior or sophomore.
Should we take these on one at a time? Because I think are there any, so Lisa's not here, but 2 of the people here, anybody else have an insight or comment into what Alex just said? I like where you landed. I actually think that you got to balance on the other side. Are the sophomores ready to take on a program or a project like that? It seems to me that the junior is actually the sweet spot, even though they're busy. They seem to have 28 hours a day when they're that age, and I think that opening it to sophomores and juniors, and I don't think it should be a one and off. I think juniors who apply, who aren't accepted, should be. I think you raised that idea, and I don't see why we do that one and off. I don't see why you wouldn't just codify that into the process. That it's for juniors, sophomores, and juniors, and seniors who wish to reapply.
I think the reason, again, for phasing seniors out is just the timing issues of having them for less time, and very often we find that we do need that extra month. I think that's really the main thing.
So you see that as one and off this year, if there are people who were...
That's how I see it. I think Lisa was pretty much on the same page as that. Seth, I don't think you have a senior yet, but I know Lisa has kids in high school, and that was sort of her opinion as well.
Yeah, my perspective on it is really about what I think the value is to the student themselves in terms of influencing their trajectory for what they're pursuing after high school, and how they utilize the experience to gain access to college or university. And I think that the opportunity for the students to influence them and their trajectory is greatest below the senior level. It seems like by that point, when they're seniors, they've already made a lot of decisions. So that's where I was coming from with that opinion.
And the other point I'll just, in terms of, the seniors not apply, is this is actually somewhat of a common thing in terms of how some extracurriculars at the high school operate for students who are interested in applying, for example, to be student representatives on the school board. I believe they can apply, I think they have to apply in their sophomore year, if I'm correct about that. I don't know, Jenny, if you know that offhand, but I think that's...
I don't know
Okay.
that right offhand, but I do believe you're right.
Yeah.
But I would hate to say it flat out.
So in terms of the readiness, I think if our school board thinks they're ready to, represent on the school board, I'll, sort of trust that a little bit. And we have opened up to sophomores in the past as well. And I can also just say, having read the applications, there were at least 2 of those sophomores who were already very impressive in their applications as sophomores, who then reapplied this year as juniors. So I think, I think that I understand your concern about that, and I think there was a little bit of the same feeling, but I think that there will be some sophomores who will apply, who will also, and it's also the year that they're taking, is that still health class is sophomore year as well?
So it depends on the student.
Oh, okay.
It's very, very different. It just depends on their scheduling and all the things that they try to fit in.
Okay. And again, there are also some other extracurriculars that there are some others where if you actually can't join as a senior unless you already did the particular club as a junior or sophomore. So I think
I'm not seeing any
yeah.
objection. I think you've made the sale.
okay. So that was one of the points. In terms of what we expect in their application, I think we were all pretty much on the same page about that we would like to start asking for a transcript In terms of setting any kind of GPA requirement, I believe where we all kind of met in the middle on that is that rather than just charging in with a GPA requirement, let's ask for the transcripts for a year, see where we're at with the GPAs, and then if we want to put in a requirement to kind of, thin out the number of applications we have to look through, we can always do that later. But let's start with collecting the information first, and then we can figure out how to best utilize that information potentially in subsequent years. And then also specifying a resume, which some students had been submitting, some hadn't, because we hadn't really specified, and also laying out a little bit what should be in their application letter, which I think we can essentially say is like a cover letter. For many sophomores, I don't know that they're going to have written many, if any, cover letters yet, and just providing some guidance on what to do in that, with really the points being, why are you interested in this position? And in particular, giving a little bit of guidance on, we've had a lot of applications in previous years where essentially the reason for wanting to join is I have one or both parents who's a doctor. Now that's great, but not all doctors deal with public health. It's sort of like encouraging them to maybe dig a little bit deeper on that so that they have the opportunity to actually do that rather than just submitting that and they don't get that feedback and they're sort of out the chance to give a better explanation. And then also just kind of, a basic summary of the qualifications. That's part of any cover letter, but again, if it's their first cover letter, they might not know that. And then Seth, you had raised something else that was going to go in about like kind of what's your understanding of what public health is and what, again, just kind of asking for that explanation of why public health versus just healthcare or, medicine in general, but why public health specifically. So I think that was pretty much where we were on the materials, is transcript, which they can get an unofficial transcript relatively easily, was Lisa's input. So unofficial transcript with, of course, we're going to look at the grades, but no hard requirements yet. And then cover letter and resume.
Sounds great. And then you said there was a third?
So then the next thing was in terms of how we're deciding and kind of what process we're using for picking the students. And I think we can kind of roll that into how we're deciding on the projects. In terms of how many students we're going to take on, I think, again, that can be rolled into how we're deciding on the projects. I think Lisa and I both really liked the model that Seth has kind of pitched, of board members essentially put forward a project that they would be willing to sponsor, and then students in their application can, if they don't want to pitch their own project, they can talk about which of the projects we're offering to sponsor that might be something that reflects our area of expertise. We have a pretty diverse board in terms of different medical backgrounds. I think that our feeling was that that's a good way that students are really going to get the most out of the projects. That does mean essentially that we're recommending that students would be working individually. I understand the reason for, kind of pushing the group direction in the past. One of the points that Lisa has brought up in the email exchanges we had, which was a good point, is if we're picking 2 or more students kind of blindly, we don't know what their extracurricular schedules are. We don't know, how, if they're in any of the same classes, what their ability really is to get together. And so there are other, issues that go into them working together other than just, getting along, which, of course, that's a good life lesson. But in terms of, again, just the scheduling of different school schedules that we're kind of going into blind a little bit, and then adding in the schedules of the respective coordinators, it just gets a little bit hard to kind of coordinate all of that. And then again, offering each student the opportunity to, pitch or pick a project that is, kind of what they're looking to study.
Alex, while I definitely agree with everything that Alex said, I just want to underline the main point that I was making is that I think these projects are a significant portion of what our board does and talks about when we meet. and they are an opportunity to impact the community in a variety of different ways. And regardless of whether each individual board member does a project, I think it makes sense for our board to determine what the project should be together, so that we can have the maximal impact, not just on that student, but on our community for things that we think are important for us to be discussing over the course of the ensuing year. So, I see that as its own separate point, just representing sort of my perspective on that. Regardless of whether an individual board member will help with the project, I think all of our board members should agree that these are important projects for us to be spending time and the public's time on, and the public's attention.
Yes, so that was, in terms of the points of disagreement, I think that was one of them, was the, do we allow the option for the students to pitch their own project or not? I, kind of have come down on the side of, I think that's, a good thing in terms of, certainly I think the project that was picked this year was a good one, and it's not something that I think I would have thought of, even though it's something that I think is relevant. I definitely understand Seth's point about, kind of the guidance aspects of it and the, picking something that really is representative of the community and maybe not a particular student's interest. My kind of take on it is if, you leave the option out there, and if a student pitches a proposal that, we don't feel is a good fit, then but we feel like they're still well qualified, they can have the option to, pick one of the projects that we've offered to sponsor. That's just the way that I would want to handle that.
I think that it sounds like we can have our cake and eat it if we sacrifice one thing, and that is the collaborative nature of it. That is, say, the two students collaborating on a project, which has value in and of itself, but you don't necessarily have to have that. And so I completely agree that we as a board should consider what we might see as an opportunity for the board supporting the internship program to have an impactful project. And I also think that in all the projects that have been here, most of them have come out of the heads of the kids, and most of them been good. And so I think we leave it as open as possible, but the board weighing in on what an appropriate project is, I think would be a definite upgrade, and allowing the two interns. I'm adding that myself because I think expanding the program beyond two right now would be a bit of a resource strain with regard to the board, and we can certainly consider going beyond that. But I think it sounds like you guys have given consideration to the major issues, and I guess we're pretty close to being able to codify this and put together a package of what does the program look like, and then consider what the content will be towards the end of this year. I would also wonder, is it possible to get the kids up and running in our October meeting, because it is a short year. I mean, if they don't start until November and they're done by May, it's a short year with, well, November and December are all holidays, and then there's spring break and there's all the other distractions.
Well, so I think under the model that we're proposing, in a way that would sort of be up to the individual sort of sponsor of each project. Possibly one of the other benefits of that is they might get staggered in terms of when they get finished, so we might not have to have, more than one project presented per meeting. In terms of the other issue you raised of the number of students, I believe that, again, if we're going to this model of individual members are sponsoring a particular project, then we're only limited by the number of board members that are willing to sponsor a project. Now, there are some other practical limitations on that, the first of which being the room we're in. Given the number of liaisons we have, there are only 7 free microphones. So even if all 9 of us did want to pitch our own project, we'd be limited in that sense. And then also just the timing of the actual presentations of it. I think if we move to individual presentations, I think we were pretty much all in agreement that we would roll it back to more of like a 10-minute presentation as opposed to 15 minutes. just in terms of the amount of work that one student might have to do. But then, so let's say we went with, 7 based on the number of microphones. Well, 7 times 10 is 70 minutes. That's longer than one, entire meeting. Even if we had, 5, that still only leaves 10 minutes for the rest of the meeting for the Pledge of Allegiance, changes between presentations and any other board business we might have. So I would suggest that, if we do expand beyond 2, we start small and limit it to maybe 3 as kind of a soft limit. I mean, listen, if we get 4 passionate board members and 4 passionate students and, we really want to go for it and everyone's prepared to do that, then maybe that's something we take a look at. But we do still have some practical limit, it can't just, we do still have some practical limitations in terms of the number.
So, yeah, I think we can keep that open for the moment. I'm hesitant to go beyond 2. It sounds like there's a lot of enthusiasm for going beyond 2, and I certainly wouldn't stand in the way. My problem is you not only this then becomes Student Intern Program Board as opposed to the Board of Health. That's one, and 2. If you wait till next year and see what the applications look like, then you have problems with ramping up, because you have the process of soliciting, deciding, allocating a mentor, and getting the project started. So I don't feel that we need to make a hard decision right now, but I think that going beyond 2 it's just like anything else. You start to it's an order of magnitude increase in the volume of work, not an additive increase in the volume of work. So
Sure.
can we
And
move that to
so then
next? Go ahead.
one last thing on that then is, so in terms of the actual selection process, I think really the model that we were going with then is whoever's sponsoring, if they get more than one application who wants to do that project, they would sort of be the one responsible for selecting, since they're the one who's going to have to carry that project through. And then it would be up to the rest of the board if we do allow the option for students to pitch their own project. Certainly, I'm happy to review any applications that come in under that. I think we would open it up to, if there are other board members who are interested in reviewing project pitches that are agreeing that they would also then manage it if they were picked, that they would also be involved in that
Yeah,
selection.
I'm going to suggest that at this point we kick that can down the road, because I think what the topic is might also, suppose we come up with a topic that would need 2 hands or 3 hands as a board. So I think we need to, I think we need to build in flexibility with regard to topic selection, whether it's 1 or 2 people on a topic, and whether we have 2 or more interns. I think expanding it is an interesting idea, and flexibility with regard to what's in front of us is going to help make it most successful. I think the most important thing is the engagement of the student intern and the engagement of the mentor are the most important things for a successful project. Okay. Shall we move on? Dr. Desidu's lecture will also be kick that can down the road. We'll figure out how to schedule that again, and that brings us to a new business. Maggie on the Board of Commissioners, I did forget to put an old business topic in. If you have an update for us on the school bus cams program, but I'll turn it over to you, Maggie.
Sure. Well, where we left the school bus camera issue was sort of the township staff and the school district staff were going to work on it and see if people could come to some sort of a compromise. I did speak to the township staff here about some of the ideas of actually getting in touch with the bus drivers, with the transportation department, noting complaints, keeping tabulation on complaints. And so there was some communication there. And otherwise, I don't know anything. Do you know anything more about the school bus?
No, I really don't. I do know our transportation department works really well with all of the different things that we do with keeping the data of things that are going on inside the bus as well as outside the bus while we're transporting our students. So yes, they are continuing to look at that.
So Jenny, I think you missed the last meeting. The idea was that before we would consider hiring an outside firm, and all the issues that we discussed on that was, do we have a problem that requires a solution, or is this a bit of a tempest in a teapot? And people thought that the best way to get at that would be to simply ask the drivers, have you had incidents with cars on the road ignoring your flashing lights? And if there's a lot of those reported, then you proceed. If there's almost none of that reported, then it's not a problem big enough to take on a for-profit contractor who wants to put a significant capital investment into cameras on all the buses.
Making data-driven decisions is kind of what we do all day, every day. So that would be a really good way to do it.
Yeah, so a couple other things. One or two things about not so much human health, but the health of the planet. We did start to enforce the plastic bag ordinance starting the 15th of March, and indeed, Giant has taken in all their plastic bags. They now have nice little stands where you can put your reusable bag, and paper bags are 10 cents, and they, of course, have bags for sale, more durable bags for sale. So that's a good thing. And on a similar note, the township last Thursday just got a nice grant for upgrading some of the township fleet to electric vehicles and putting in some charging stations. So again, something for the world.
How did that come about, Maggie?
It was a state grant that Melissa Cohn here applied for, and just found out last Thursday that they got it. So that was a good one. They also got a good crosswalk on King of Prussia Road, Ward 2. So that's another good one. And then I don't know if people had heard, but in the last several weeks they've been doing deer culling, which again is an emotional issue for some people. But they have kept pretty good data, and the number of car strikes has gone way down since they started doing deer culling in the township. And they do it annually. Actually, it's the USDA who does the shooting at night in the larger parks and some private land that people allow them to use. They donate all of the venison to food banks, and they get a huge amount, actually. I think it was 60,000 pounds. Seems like a huge amount of venison. Anyway, so there have been a few complaints of people hearing shots in the middle of the night, and of course calling the police, which, that's why I'm sort of trying to get the information out there. I think they may have finished up last week, but there may be a little bit more. And I guess that's about it. Our old friend, the Kratom Delta HTHC store that is not going to have those because of the ordinance against them, is jumping through the appropriate hoops to get business permits to open up as a CBD store. So there's some objection to that in the community as well. But I think that's legal, and if they put the right business permits out there and go through the right hoops, that we may be seeing that in the old Starbucks location. So
Thanks for that update. That would be pretty encouraging not to have that as a derelict building sitting on Lancaster Avenue, but
with bright green paint, yes.
the bright green paint, exactly. Jenny, you got an update for us from the school board?
Sure.
School district,
I could talk about a couple of different things, but I will state that just even most recently, we really have been doing a great job, our students, our staff, in being able to maintain as much safety as they possibly can to keep themselves physically well. So we're not seeing any increases in any of our buildings, and have not for quite a few months. So yay for that. I will say, and I don't really know if this is health related, but it is parent related, and it kind of is health because we're going to be having a parent training, and it is in April. It will be on our website. I think they already put it out in what we call the Radnor Reader, which goes out to all of our parents, but it'll also be on the website. We have a person coming to us who is a well-known author. Her name is Debbie Reber, and she's going to be presenting to our parents about having our parents really know who their child is. A lot of it is geared toward students that are not neurotypical, but it is also for just even typical students that are possibly struggling academically. But another piece that she's really talking about is the mental health of some of our students, and just providing some strategies for our parents to understand who their children are at any specific time and different ways to assist them. And there'll be a big question and answer afterwards. And I forgot my computer. It's in April. It's after the spring break, and I believe it is the 19th. But if anyone goes on the website, it is up there. And like I said, her name's Debbie Reber, and the training will happen at Radnor Middle School.
Thank you. So in the absence of any comments or further updates, public participation is now open.
Can I come up to the...
Yes, please do. Please do.
Hello, everybody. My name is Adam Al-Assad. I'm the Director of Operations at Savage Sisters Recovery, Inc. Thank you, Kiki, for having me out today, and thank you all for taking the time to listen to what I have to say. So Savage Sisters Recovery is a 501c3 nonprofit organization focused on attacking substance use issues. We do that through 3 programs: housing, outreach, and education. Today I'm here to talk to you guys about the education aspect. There is currently a need to educate our youth on substance use issues.
Sorry, very quickly, I'm just going to recommend that you stay close to the microphone so that anyone watching either on TV or later on YouTube doesn't lose what you're saying.
Oh, is this being recorded? I didn't know. Okay. Gotcha. Typically when I'm presenting, I'm actually presenting to our youth, to high school and college students, and I like to do a lot of pacing, but I'll do my best to avoid that today. Yeah, so what I was saying, substance use education for our youth. It's something that the organization I work for has been doing for quite a while, and something we've been advocating for each Pennsylvania county to kind of take on and get done. So the reason that we've been doing that, I guess I should say first, the education program we've had has been open for 5 years, but about 2 years ago we adapted so that we could specifically focus on high school and college students. We still present to everybody else, so places of worship, your workplace, other health departments, other nonprofits, et cetera. But we did team up with a group of researchers at Drexel University to specifically get information and share it to high school students and college students. The reason for that being the incredibly alarming data that came out over the last few years showing the effects that the overdose epidemic has had on high school and college students. Specifically, from 2019 to 2020, there was a more than 100% increase in teenage deaths from opioid overdoses. From 2020 to 2021, that number increased by another 20%. The data has not been released in 2022, specifically for teenagers. However, I can tell you in 2021, there was 100,000 overdose deaths, and in 2022, there was 120,000 overdose deaths. So those numbers are not going to be good when they do come out. So I mentioned the numbers for teenagers, so specifically the 100% increase. They are currently the fastest growing age group to experience an overdose death. When you think about the opioid epidemic, especially here in Radnor, I'm a RHS alumni. I grew up in Garrett Hill. There's a lot of stigma around it. You can't really talk about it. I certainly couldn't as a kid, and it wasn't talked about in my school. I've been presenting this information. I've been presenting a lot of information to high school students. I'm not going to get into all of that today. We have a pretty limited time slot here. But I've been advocating in Philadelphia specifically to get, as well as my organization as a whole, to require all public schools to have some form of substance use education for their students on a regular basis. So whether it be biannual or annual at the very least. And we've accomplished that. We met with the Philadelphia School District, and we've since presented to over 1,000 high school students. We've also presented to over 2,000 college students, whether it's at Greek Life or in a college auditorium, et cetera. Alarmingly, haven't been able to make it into a single school outside of Philadelphia. So that stigma that I mentioned earlier, it is still 100% present, and there is no avoiding that, unfortunately. So after communicating with a variety of different schools in Radnor, I recently had a conversation with Principal Kevgis, and she informed me that Radnor was actually currently contracting with 2 for-profit organizations to address these issues, which is incredible. Those organizations are Lakeside and Caron, so Lakeside Medical and Caron Foundations. Both are for-profit organizations and both do really good work, but unfortunately neither of them are equipped or currently providing the information that we provide, which is necessary to save the lives of our students. Specifically, they do not provide any form of overdose prevention or overdose reversal education. And in fact, when I had that conversation with PT, I followed up with my nephew and my sister, Aaron and Dylan, who are both Radnor High School students. And I said, have you ever heard of Lakeside Medical or Caron Foundations? And they both said no. They'd never heard of them. They'd certainly never been presented with an overdose prevention or overdose reversal training or anything of that sort. So I followed up with PT and have yet to hear back, but that was very recently, so not putting that on her in any way, shape, or form. What I am aware of, though, is that there's absolutely not, the need for education is absolutely not being met. And I said, one of the things I mentioned to PT was that Lakeside and Caron could likely provide that information, as could the Department of Health that was newly created in Delaware County. However, none of them are equipped in the way that Savage Sisters Recovery is. That is because of the work that we do on the street every single day in Philadelphia, where the trends that the rest of the country, and at the very least, the rest of Pennsylvania see on a regular basis, start in Philadelphia. Specifically, we have been contacted by the Pennsylvania Department of Drugs and Alcohol Programs, as well as single county authorities from 4 different counties throughout Pennsylvania to provide their health departments with the training that we offer. So obviously, the students that we educate are not getting the same exact training as the single county health authorities and the departments of drugs and alcohol programs, but they are getting a very similar training. It's just adapted to specifically cater to their needs, to address mental health issues, and to address the risks that they are seeing and facing on a daily basis. And some of those risks, as I mentioned earlier, have to do with fentanyl and those overdoses that I talked about. So what can we do? So that we can provide these trainings, we can inform the students of the risks that they face, specifically relating to fentanyl. So a lot of people think overdoses, they happen to people who are chemically dependent upon heroin, for example. They happen to the unhoused community in Kensington, if you've ever heard of it, the people who have been using heroin, who are using syringes. But unfortunately, that's not the case. They are not the most at-risk demographic to suffer from an accidental overdose, accidental opioid overdose. It is actually people who are taking substances that have no idea that they are taking opioids or at the very least fentanyl. It's people like my brother in Radnor High School who overdosed several years ago and was actually, the overdose was actually reversed by a Radnor police officer who showed up at my mom's house shortly after the overdose happened. It's people who are restaurant workers in Radnor Township that are doing a line of cocaine. It's people who are doing an Oxycontin or a Percocet after their script was taken away by their doctor, who are still chemically dependent upon that substance, who are buying it off of the street from a friend or somebody who they trust, and that friend and that person that they trust might not even know that the substance that they're supplying to their friend or family member is actually a fentanyl pressed pill, which is ultimately the risk that our students are facing, and they are not being informed of that, and they are not aware of it, and it's really incredibly easy to inform them of these issues. The offer to provide these trainings has been presented to Radnor High School specifically several times over the years by my organization. But I'm not specifically here for Radnor High School, I'm here for Radnor schools as a whole, and I'm not actually sure what the other high schools are are currently doing. So Carol, for example, I have no idea. I know what Radnor's doing. I don't know what the other schools are doing. I can tell you in 2017, a big part of our overdose prevention and reversal training discusses Narcan, naloxone, the overdose reversal drug that is a nasal spray that is completely risk-free. You cannot you cannot overdose on naloxone. There are no dangerous side effects. You can take as many naloxone as you want. If you've never had an opioid in your system, you're going to feel absolutely nothing. So that is something that I do want to be clear on, because in 2017, when Radnor discussed introducing these naloxone into all of the different schools, there was a lot of really alarming narratives that went around with that. For example, that the Good Samaritan Act didn't cover it, but that's obviously not the case. The Good Samaritan Act does cover naloxone in Pennsylvania and every other state, but specifically in Pennsylvania. I've researched the Good Samaritan Act on that pretty intensely, and it's very wholesome. In 2017, they discussed bringing naloxone into the schools and ended up only allowing certain nurses to have access to it. It's treated like Ritalin for students, so they can't actually have it on them when they're in the school, which blows my mind because, as I said, you cannot get high off of it. There's no risk of overdosing on it. It is a harmless substance. So bottom line, Radnor is not currently taking action to educate our youth. They've been provided the opportunity to do so, but I haven't heard any good information on that yet. So on that note, do you guys have any questions on the matter?
Do you have a specific ask? Is there something that you would like from the Board of Health of Radnor Township?
Yes, I would like you guys to communicate with all high schools and potentially middle schools to inform them of the opportunity to provide their students with overdose prevention and reversal trainings from Savage Sisters Recovery, the nonprofit, as well as, and if this is something that we always try to talk about, providing any entity, whether it be a student or a school, with the autonomy to choose their providers. So if it wasn't Savage Sisters, there are a number of other organizations we are familiar with, including the Philadelphia Health Department, to provide these trainings. Currently, the only organizations that Radnor mentioned that they were contracted with was Caron Foundations and Lakeside Medical, both of whom are reacting instead of preventing the issues. They are reacting in the sense that the one thing Radnor does is if they suspect a student of having substance issues, they essentially give them a reference to Caron or Lakeside, which are both for-profit entities. Kind of alarming.
Thank you.
Yep, absolutely. The only other thing I wanted to mention, because this came up over there, Kratom Delta 8, the issues that you guys were facing there, Lisa Borowski was a pretty big leader on that. Just for example of the information that my organization has access to, they reached out to Sarah Laurel, the executive director, and she actually provided them with most of the information they used to then go after that.
Sarah was here at the time of the meeting. She spoke in front of the board.
Yeah, so Sarah is the executive director of Savage Sisters and created the presentation that we share to students, just for your info. Yep.
Thank you.
Absolutely. Thank you for having me.
Other public participation? The process for public participation, Adam, for your benefit, is we don't respond in the moment, but take things under consideration.
Of course, yeah, I understand.
Thank you. So with that, we've hit the end of our agenda. Unless there's somebody else who wants to weigh in at this point, may I have a...
Sorry, David, excuse me. I just wanted to thank Adam for his information. It was extremely thorough, and I just wanted to break that information down in one piece quickly. I know we're way over time. We tend to say 100,000 overdose deaths a year. It's an easier number to understand when we say it's 150 deaths per day. That is alarming, and I would like to be of any assistance if possible to integrate any programs into the school district or to our township programs. So if you could make a note of that, David, that would be my pleasure to do that.
And so I'll try and be quick, but I mean, I do appreciate this being brought up tonight, especially with Maggie, the news item you shared about the that store reopening, because one of the biggest sources, I mean, there were a lot of news reports about this not even a month ago, is, the so-called natural supplements that are, THC or cannabis products, because they're not really regulated because of the fact that they're natural substances. There was a huge amount of those, I don't remember any exact numbers off the top of my head, but like a really big portion of those products were found to have fentanyl in them in many instances. And, that's just something I definitely think the community needs to be aware of. Not all green leafs are natural, especially when they're, nobody's regulating them.
Then do I have a motion to adjourn?
Motion to adjourn?
Second?
Second.
Any objections? Then the meeting stands adjourned.